My name is Justin Millar. I am the Information Technology Director and Security Management, and I have been here 2 years this month. We discovered in the process of regimenting our forms, essentially, like making them consistent, that we had things that were out of order. We had signatures that were, not captured in the right timeline, per se. And Access eForms makes us do that in the right timeline, which is so much better for medical records and those kinds of things. And yes, it was an adjustment the first week or two, but I think our first month we had over 4,000, 5,000 forms. It was in the thousands of signatures and captured that were all done seamlessly without, you know what I mean? Like, you think about how many, if you went into HIM department beforehand and you would see stacks of papers that needed to be scanned. And now when you go in there, there's nothing.
Being in a rural setting like this, we don't have like 5 or 6 people to check patients in. That's what we used to do, because most of the time you would have 2 or 3 people standing in your line getting ready to be checked in. And so you would just have a clipboard and you would have the consent, like the notice of privacy practices, and then you'd have to have your HPI or and so they would go sit down and fill it out, and we would hear them grumble. It's like, I just filled this out, why am I filling this out again? And so and sometimes the doctors were ahead of us, and so they would want these patients to come back and they wouldn't have their paperwork filled out. So then either it wasn't dated or signed, or we didn't have a witness signature. And so again, well, we call it joint commission. We have joint commission, and they would audit our charts and say, you don't have a date, you don't have it signed. And so we were getting in trouble for that also. So like I said, Access has just really been a game changer for us.
Now we're probably looking at reg at a 2 to 3 minute mark. Prior, you probably would add an additional maybe 2 to 3 minutes, simply because you had to print out the physical face sheet. So now with Access, those 2 to 3 minutes we can kind of eliminate, because we are launching, the face sheet on a pad through our cows or either at, our workstations, and we're able to submit it, real time, and it's available for anybody to pull off the patient's account.
And I'm going to pick on one of the ED workflows because I think it really highlights workflows in presence. So when one of our registrars, they have mobile carts, they come into the room to register a patient. Many times they're waiting on a doctor, about to see a doctor, and the registration team needs to get in as quickly and efficiently as possible. So that way we're not delaying any type of nursing or provider care. So once they're in, they can go through our registration. Generally takes about 2 to 3 minutes. They don't have to leave to go get paper. They don't have to go looking for a pen, and everything's right there at their fingertips on their cart. They can hand the walk-on pad over to the patient, get their signature, explain any type of HIPAA, any type of what they're signing for, advanced directives right then and there, and then they get to leave.
Before Access, we used paper consents, paper PHI forms, everything was paper. We were ordering new forms on a bi-weekly basis, and we would order boxes of paper, for our consent forms. We would go through, it would be nothing for us to go through a case of paper in 2 weeks' time. And so with Access eForms, of course, we're not using paper. And so it's environmentally friendly. It saves a lot of time. I would say we're probably saving 5 minutes per registration now.
Before we went with Access, I didn't really even think about the cost of like the paper, and then the time that patients or that our staff were using to scan in paperwork. And then we have the shredder. And then we have scanners that, they have to be fixed or maintained or whatever. And I thought, gosh, we have really cut down on a lot of cost by going with this one product.
It's not about the bottom line. It's about providing an experience for all of our users, whether we be IT or the medical staff here at the hospital, to allow them to be successful in their position. And if I can do that through innovation, through new technologies, and through support of those technologies, that's what I'm going to do. That's where I want to be. And Access eForms was one of those tools to get us on that avenue. We saw the integrations that could happen. Being part of Meditech is, a phenomenal, integration that everyone loves. I know that Meditech themselves uses Access eForms for their forms. So that was a big, kind of like, oh, well, if this is the company that they're using for their own forms, that should speak volumes to the kind of product that they want to have and we want to have on our campus.